welcome back, and thank you very much for staying with us. Let's get back to that conversation we were having regarding the WHO Global TB report, which was released last week as an annual report, and it is an important event in the ongoing monitoring of global trends in TB, an essential component of ensuring accountability towards global TB targets. The World Health Organization suggests that the TB mortality in 2020 will be more than 25% higher due to delays in diagnosis and initiation of treatment or treatment interruption during COVID-19. We're joined by Communications Director for TB HIV Care, Alison Best. Alison, thank you very much for staying on the line with me, and I do hope we have you on a better line. We're having a conversation about this report suggesting that TB mortality could rise by 25% due to COVID-19, and I was saying it is actually quite scary, and asking, is this due to a neglect of TB cases due to the overemphasis on COVID-19, or is it a case of TB then meeting COVID-19 and then obviously then becoming fatal, or really a mixture of both? And I was asking how we got to this 25% figure.
Okay, so I think it's important to think of both COVID and TB as important public health issues, and not try and divert attention from one to the other. They're both important. We should be paying attention to both of them. Now, the WHO report that was released, which was data that's a year old, already showed that TB had almost double the number of people we're losing to it per day than COVID-19 over this period. And that data is a year old, so it doesn't take into account the effects of COVID. And institutes like the National Institute of Communicable Diseases, which tracks the TB testing, has seen that there's a 30% drop in diagnosis of TB during the first 5 months of the lockdown, and then it rose. So now it's still below. It's still at only about 10% below where it should be. And when you think we already were missing 38% of TB cases, that's really, it's too much. And the reasons are probably because the health services have been impacted so greatly. Clinics have had to be closed in rural areas in order to decontaminate and deal with COVID cases that they've encountered. And that's meant that people haven't been able to access treatment. And then a second factor is patients themselves are not always keen to go to clinics at this time because they are worried about infection. So it's a layered effect.
Yeah, and we have an issue of what I've read briefly from that report. There is quite a big issue of people not being diagnosed in the first place, or being diagnosed perhaps too late. And I mean, and I just wondered as I read that with something like TB, where one can't really ignore the symptoms. And I mean, certainly you can kind of see if someone has TB, or at least hear it. Why then is this the case? I mean, it's not like a hidden disease that you can't see. You certainly can spot, if there is a problem with TB.
Yes, I think people, if they have symptoms, so the 4 symptoms to look out for are coughing, fever, loss of weight, and tiredness or fatigue. Or night sweats. So those things can be explained away as maybe I have a fever, maybe I just have a cold. So it is quite easy to deny that you may have a problem. But I think an opportunity for us now is that we are having mass screening for COVID. And we could easily be putting in screening for TB at the same time. And that could help us to get back some of those losses that we've experienced thus far. So we might be able to start finding more of cases again if we start using this integrated approach.
Yeah, and I guess that's one of the lessons then, I suppose, that you might have learned from COVID-19 in terms of responding better to TB. But I also then wonder if you're saying, you know, TB can be picked up during screening for COVID-19. I mean, if the two come together, is it, you know, this is obviously a medical question and I'm not necessarily affair with these things, but is there a possibility that you'd pick up COVID-19, which of course is what everybody is talking about and what's on everyone's lips and what's being checked for, that you then ignore the TB? Or could we see both and then be able to treat both, or are they treated in a similar way? What's the story?
Well, as to treatment, I'm afraid I won't be able to answer that, but definitely we don't want to be ignoring one at the expense of the other. We want to be treating both of them because they are both significant diseases that you do need to be addressed. So I think there's no problem of integrating that screening, of finding both. We will be able to deal with both.
Yeah. All right, Alison Best, thank you so very much for giving us your time here on SABC News and for your patience. We certainly do appreciate it here at SABC.
Thank you very much.